All right, welcome to the Brain Health with Dr. Nissen show. Today, we are going to be covering a topic that is something that was brought up to me by one of my patients, actually, is they were asking all about how they can stop smoking. And it's a big topic, and it's something that can have such a profound impact in someone's life. So I wanted to tackle it today. So this is part of a series on addictions. We'll be starting with tobacco addictions today, but we'll continue to follow up with other addictions after this, so please keep posted. So without further ado, let's begin. E-cigarettes and smoking cessation. So like I said, I had this patient who was this older gentleman. This isn't actually him, but just a representative picture. And he was a smoker his whole life and had been trying to cut down, recognizing the risks of smoking. And he said, "Hey, should I be using these e-cigarettes or these vapes as maybe something to help me to stop smoking?" And obviously, everyone right before the pandemic was all worried about the dangers associated with e-cigarettes. So it's a tough question to answer, and so that's what I wanted to talk about in today's episode. So what we're going to talk about is first, currently, how do we help someone to quit smoking? And then we'll talk about e-cigarettes, the risks of e-cigarette use, the evidence for and against e-cigs, and summaries. And something that's going to be really important here is talking about what makes a more safe e-cigarette or vape product than another. So that might be something that's of interest for somebody who's already vaping. So first of all, introduction to smoking tobacco. As everyone is aware, it's a huge issue. It's a leading preventable cause of mortality. There are many different ways that people are using tobacco, predominantly cigarettes, but certainly I see people who are dealing with cigar addictions or things of that nature as well. An important point here is that you can reduce the illness and your risk of death pretty much no matter when you stop smoking. So it's never too late. And working with somebody increases your likelihood of quitting smoking. So, regardless of who it is, even though, you should look for somebody who's knowledgeable and a quality provider, but regardless, finding somebody to help you with this will increase your chances. So let's talk about how it's currently done. There are behavioral ways that we can help, and there are pharmacological ways that we can help. So behavioral ways that we can help are one-on-one therapy or smoking cessation programs, like I have listed here. There's a hotline you can call, 1-800-QUIT-NOW, and it will help you to get the resources that you need to quit. And then there are some apps that are out there that actually people have been finding to be quite effective. For pharmacotherapy or medications, the three that are typically used is nicotine replacement therapy. So this could be like a nicotine patch, which you might have heard somebody use, or a gum or a lozenge. There's sprays that exist. And then there's varenicline and bupropion, which are other options that you can discuss with your doctor. So in general, some people are able to stop smoking with the help of a provider. So here I have 25 to 35% of smokers who try to quit can quit for 6 months or more when they're receiving optimal treatment. Optimal treatment being the behavioral interventions that I mentioned before, or the pharmacological interventions that I mentioned before, which is the drugs, the medications. And you compare that to trying to do it by yourself, it's only 3 to 6% of smokers who try to quit by themselves are abstinent 1 year later. So it definitely helps to work with somebody and to receive that optimal treatment. So then this leads to the question that my patient posed to me, which is, are vapes or e-cigarettes helpful smoking cessation tools for adults? Well, let's talk first about what e-cigarettes and vapes are, because it makes a big difference, because there's so much variation in this field. So these are battery operated devices, and what they do is they heat up a liquid, and it actually creates an aerosol, not a gas. So you're breathing in small particles of liquid, and that's important as we talk later about the risks that poses. So these started out as being more of these e-cigarette, kind of cigarette-looking like things, to more of these vape pens and mods that are more common nowadays. So like I said, there's so much diversity in the number of products that are out there. There are over 466 brands, 7,000 and 764 types of liquids. So for us to study this and say, hey, e-cigs are all dangerous or e-cigs are all safe, it's impossible because there's so much diversity here. So generally how it works is that there's a liquid that's in there that is heated up by a coil, and there's a wick that sits in the liquid and actually gets saturated with the liquid, and you pull it up in an aerosolized form, so little particles of liquid, not a gas. And the liquids that are used are typically composed of glycerol or propylene glycol, or a mixture of the two, along with nicotine. This is important because this glycerol is a widely used food product, but it's been relatively unknown what the effects are of inhaling it. So even though something's considered safe for you to eat, that doesn't mean it's safe for you to put into your lungs. And that's something that's really important to know. This is really, we're entering kind of an unknown field here. So this glycerol then becomes aerosolized. You breathe it into your lungs. And one thing that's really important to note here is that when we did studies with mass spectrometry, where we're looking at what are the actual things that are in these liquids, it's more than what's listed on the ingredients. And there's other compounds that come out, like formaldehyde and acrolein. These can have impacts on cancer risk, for instance, and other safety problems. So this is a list just in one study that looked at the other things found in the vaping liquid, and you can see there's a whole bunch of other things in there that you wouldn't expect. So as everyone knows, this is a big issue, and it was talked about a lot before the pandemic, that there was all of these people suddenly using e-cigarettes. It went from 1.8% of U.S. adults in 2010 to 13% in 2013, almost 10 times, and almost 7% reporting current use at that time in 2013. And I haven't seen the most recent data, but I assume it's gone even up until 2020. But it's important to say that, people are using e-cigarettes, even though they were originally developed for smoking cessation purposes. They're using them not for that reason. So a study of 4,444 college students found that their vaping was not motivated by a desire to reduce or stop smoking tobacco. They're used for other purposes in and of themselves. And what's really important here is talking about the prevalence in youth. So in 2015, 16% of high school students reported using e-cigarettes in the last 30 days. This is a large chunk of this population who is normally not using these before. And like we said, the long-term effects of this, we really don't know. It's been found that in these adolescents that were using e-cigarettes, they had later a higher risk of using tobacco. So instead of being a tobacco cessation product, something to help with stopping tobacco, it actually increases their risk of using tobacco later in life. But it is now regulated like any tobacco product, in that you need to be 18 or older to purchase the liquid and the vape itself. So let's talk about whether or not this is safe. And it's more nuanced than you think. I'm not just going to be, somebody that's going to say, oh, it's 100% bad. There is a risk benefit to weigh here. So from rodent studies, so this is looking in mice and rats, asking the question, is this safe? There have been some pretty concerning findings. So in a study of mice, they looked at what was going on in the lungs after these mice were sitting in an environment with the aerosolized, with the vape gas, or the vape aerosol in the air. As they're breathing it in, their lungs had more oxidative stress and alterations in the endothelial barrier of the lung. So in general, there's just more inflammation that's happening in the lungs. And the barriers are starting to become more leaky between the cells, which I can talk a little bit more about later. So it also was found that e-cigarette vapors depleted levels of glutathione, which is a major antioxidant, and increased levels of pro-inflammatory cytokines. So this is the pro-oxidant, and you're losing your antioxidants, so you're becoming very oxidative, very inflamed in the lungs. And then, most importantly, a study showed that they were more susceptible to bacterial and viral infections. And I have this underlined and bolded here because we're currently in the midst of the COVID-19 pandemic. And it was found that mice that were exposed to these vapors had higher rates of viral replication. So the viruses were able to replicate more and more in their lungs, and they actually had more virus-induced injury and death compared to mice that weren't exposed. And also they were given bacteria into their nose, and they were found that they had worsened bacterial clearance from their lungs when they were breathing in the vape sort of smoke as compared to mice that were breathing regular air. So those are some concerning findings. So what have we found in humans? Well, it has been found that there are different risks depending on what you're looking at. So first of all, you have the risk of nicotine by itself. Nicotine generally is not, it is very addictive, but of the drugs of abuse and of addiction, it is not one of the most dangerous in and of itself. But you have now had people who have been having nicotine toxicity, which is really rare outside of vaping, where you're taking in too much nicotine and you're getting very nauseous, vomiting, having headaches and dizziness. And there have actually been cases of death from consuming directly the e-cig liquids because of too much nicotine. So it can be dangerous, especially like if you have a baby or kids that actually may drink the vape juice by itself. So the other thing that's happening is that there's been some concern about the effect that nicotine has on the developing brain. So in women who are pregnant and in young children, it's been found, like I had mentioned before, that there's a greater risk in kids that were exposed to higher levels of nicotine through vaping, that they go on to develop tobacco dependence. And nicotine in and of itself can increase their susceptibility to cocaine and other illicit drugs that have similar sort of stimulant properties. So those are some of the concerns about safety for children. And, looking at this, so somebody might still ask, well, hey, but smoking cigarettes is really bad. So in comparison, is this still better, even if there are risks? And it's a good point, because in comparison, cigarettes will increase heart rate and blood pressure more than e-cigarettes will. They will increase arterial stiffness more than e-cigarettes will. They won't have the same impacts on lung function and asthma symptoms. Some studies have shown, and this is kind of in more of an immediate time frame. We don't know what the long-term effects are, but at least immediately there are improvements in lung function and asthma symptoms in people that switch to electronic cigarettes. And there's likely not the same lung cancer risks as there would be for tobacco products. So people do argue, well, hey, maybe they're not great for us, but maybe it's still a reduction in the amount of harm that we would get versus smoking cigarettes. But then we had the cases of EVALI happening before the pandemic. You guys might have heard about this on the news, where we're having all these, people, especially kids, getting extremely sick and even dying from these extreme lung injuries related to vaping. So as of January of this year, there were 2,602 cases in the CDC, including 57 confirmed deaths. Listen to this, though. 76.9% had been using THC-containing products. THC is the psychoactive component of marijuana. So marijuana sort of based or containing e-cigarette products. But also what's really important is that 62% of these patients with EVALI were between 18 and 34 years old, and 16% of all of them were under the age of 18. So this is really a disease that's having serious impacts on the lungs of young people. So like I had mentioned, 76.9% of these cases were related to THC-containing products. And what was specifically found is they did a bronchoalveolar lavage, which is where you take fluid and you wash it through the lungs, and you look and see what was in the fluid. And what was found is that there's this vitamin E acetate present in all of the samples. So this is a thickening agent that's used in THC-containing vaping products, which, like I said, are marijuana-based or cannabis-based vaping products. So we don't know for sure whether that's 100% the cause of EVALI, but it's very likely that this vitamin E acetate is playing some role, and the THC-containing products playing some role. So perhaps this very serious risk of EVALI is less so in true nicotine-only, glycerol-only containing products compared to THC-containing products, but it's still not very well understood. So let me show you some of the evidence that goes for the use of e-cigarettes as a way for you to help cut down or quit smoking. So there have been actually several very good studies to show that e-cigarettes may be helpful. So there was this Flemish study. It was kind of small, only 48 patients, but they found that there was a reduction in cravings that was similar to actually smoking a real cigarette. So it helped with the cravings, and they smoked significantly fewer conventional cigarettes over a 12-week period. So hey, maybe it can help with cravings and help you to cut back. This other randomized trial, slightly larger, 99 patients, demonstrated that there was reduction in number of cigarettes per day. But this was for both nicotine-containing and non-nicotine-containing e-cigarettes, meaning that, there was a reduction. It helps you to cut down for your cigarettes, even if there is no nicotine in it. So that was interesting. There was a better performance from the nicotine-containing electronic cigarettes. But yeah, so again, more evidence here that an e-cigarette may help you to cut down. And then a larger randomized controlled trial over 1,000 patients. Oh, sorry, it wasn't controlled. It was a randomized trial. A bit tricky here, but basically they had their best results with patients who had both a nicotine patch and a nicotine-containing electronic cigarette. And it helped for there to be greater smoking cessation, so stopping smoking at 6 months. And another study in Italy showed smoking reduction. And at 12 months, though, there was no significant differences between the groups. All right, I'm getting a little in the weeds here with these studies, but in general, I think what my takeaway would be is that there are a good number of studies that demonstrate that e-cigarettes could help you to reduce your cravings or cut down completely. But it should also be noted that in the ones that compare e-cigarettes versus what we currently use, patches or medications, it's not like a home run. So maybe e-cigarettes could be helpful, but it's not may it work for some people, but it's definitely not something that could be a home run for every single smoker out there. So I want to balance this against the negative studies that show that there's no difference. So there's this randomized controlled trial, pretty large one in New Zealand, that showed that there was no difference in the 6-month quit rate between those using e-cigarettes and those just using a patch. So that's important to note. A large, well-done, randomized controlled trial said, hey, it's the same as using a patch, but at least with the patch, you're not facing some possible risk of lung damage. And let's see. There was another one that was important here was that those that in this study of over 2,000 people, what they were looking at is whether or not people continued to use electronic cigarettes or nicotine after becoming abstinent. So after they'd stopped smoking, the people that were using e-cigarettes were actually continuing to use e-cigarettes and nicotine longer after quitting smoking, which demonstrated like, hey, these e-cigarettes are full of nicotine, and so you're taking people that are already addicted to nicotine, you're giving them nicotine, and then whereas somebody else might have otherwise been able to just get tobacco and nicotine out of their life, now you're kind of stringing them on for their whole life with this nicotine dependence. So that is something to keep in mind. So in summary, you can see that it's kind of a mixed bag. There's evidence for the use of e-cigarettes. It can reduce cravings. It could reduce probably the number of cigarettes on average consumed per day for some people. And there may be some evidence that will increase your chances of quitting smoking altogether, but it's not a home run. These results are not, 100% of people that use them to quit smoking succeed. And what's important here is that there are risks associated with e-cigarettes. Like we know, there are risks on the developing brains. There's risks of EVALI in the context of THC and vitamin E acetate containing electronic cigarette products. So if you are going to use an e-cigarette, definitely do not use a THC containing or vitamin E acetate containing electronic cigarette product. And really what the elephant in the room here is that there is inflammation that it causes in your lungs. We don't know exactly what that will do long term. So in light of the pandemic, the evidence of increased lung inflammation, viral reproduction, and possible ACE2 upregulation. So ACE2 is the way that the coronavirus enters the lung cells. And so there's many reasons to believe that electronic cigarettes may have some risk, and particularly more risk in the current pandemic that we're in. So I would just encourage everyone who's trying to quit smoking to first of all get involved with a provider, because like we said at the beginning, that really increases your chances of succeeding, and then get involved in some sort of therapy or group support in addition to some of the currently FDA approved treatments, so medications, patches, things of that nature. That would probably be the safest thing for most people in light of this pandemic. Maybe once it clears, there may be some role for electronic cigarettes, but I think it's important to be mindful of the different risks out there and not to sell it like it's a grand slam, because I think just about all the evidence out there shows that it's not a grand slam. But I hope you found this interesting. There's a lot here to unpack. There's a lot of thoughts and strong opinions about vaping and e-cigarettes, but I hope you found this to be very helpful.